Greetings, this is MK and you are watching an Apter Institute presentation. Today's video is part 1 of how to manage shin splints, looking into incidence, the pathophysiology and how to diagnose it. So what is shin splint? In the medical community, shin splints are referred to as medial tibial stress syndromes, which is a fancy way of saying that the inside part or your medial part of your shin hurts. The incidence of shin splints ranges between 13.6% to 20% in runners and up to 35% in military recruits. In dancers, it represents about 20% of the population, and it has been seen that up to 35% of the new recruits of runners and dancers will develop MTSS. And in the incidence in 2 of these papers by Becker et al. And Mulwad et al. Has shown that medial tibial stress syndrome is most common in running-related injury, but the exact nature of the condition isn't well understood. So in this both this paper, MTSS has been shown to be the #1 causes for pain in most of the athletes. Now, running, how does it happen? So in a normal running scenario, running stresses bone through the muscle contraction that occur, as well as the form or the impact of landing. So loading basically causes micro damage and remodeling that happens, which is normal, and then it leads to a more stronger and denser bone. So this recent research by Winter et al. In 2018 suggests that it may be a bone overload injury. So this unrepaired microdamage accumulation may underlie the pathophysiological basis for MTSS in athletes. So MTSS is thought to occur when that bone loading exceeds your ability to positively adapt. So Warden et al. In 2021, he refers it to this as an error in workload, which means that your weekly running speed, distance or frequency were more than what you could handle. So this is how one of the causes why they predict that MTSS could occur. So Winters et al. In 2017, he wrote a paper on how to assess the condition in a stepwise process, and it is the most common literature available. So how do we assess it? So it's mostly a objective and subjective assessment where you can develop a working diagnosis of MTSS. So these are the questions you need to ask. Do you have pain with exercise along the inner portion of your shin? And is your pain worse with physical activity and better with rest? Now, if they answered no to either of these questions, you probably do not have shin splints. So the next question would be, do you have cramping or burning pain in your calf? Or do you have numbness or pins and needles in your foot during exercises? If you have answered yes to either of those questions, then you may have to consider other diagnoses such as chronic exertional compartment syndrome. And if you have other symptoms or signs not typical of medial tibial stress syndrome, such as visible severe swelling or redness, then you do not, it is not associated with MTSS, okay? And the questions which is confirming or giving a working diagnosis for MTSS is, do you have recognizable pain on palpation that's greater than 5 centimeters or equal to 5 centimeters in length? Okay, shin splints are usually associated with a diffuse pain, whereas stress fractures are associated with focal pain. So if it is less than 5 centimeters in length, you should suspect stress fracture. So if they answered yes for the above question, so the next question is pain provoked by during or after physical activity and reduced with relative rest. And if they still answer yes, then it's most probably tibial stress syndrome. So you can see in this video, usually when they're running, they start having pain and they start rubbing on the inner area of the posteriomedial aspect of the tibia, right? And how do we manage this? So the most important thing to understand is that the poison is actually the antidote. So rehab is about finding the optimal amount of loading that will induce beneficial adaptation. And how do we do that? It's through load management and activity modification, resistant exercises, plyometrics, and then slowly graded return to running activities. So that's the end of part 1, and stay tuned for part 2, where we will be discussing on what are the exercises, what are the exercises we have seen in the literature and how to apply them in your clients. So please subscribe to our YouTube channel at Apter Institute so that you can get more free videos like this. And also do visit our website at apterphysio.com for all the details about our institute and the courses we are providing. Okay, thank you very much.